Annual Recovery Fest and the 4th Annual Barbecue Cook-Off of the Recovery Fest. My name's Don Harwell, if you don't know.
Recovery, are you in recovery yourself? Hey, you guys ready to vote? A surprise, a new challenge, a lesser achievement, but greater happiness.
Right, face. Precinct.
And of course, Sean Davis, a board of supervisors from Hanover County, which you want to know him too, because he's one of the few people I know that is really working really hard up in Hanover to try to bring recovery support services to the system of care up there, of which I definitely have eyes open on you. So Sean, you can come up. Shannon, come on up. Let's give a warm welcome to Shannon and Sean.
So the first thing I'd like to do is always thank John and Carol for inviting me and always inviting me to participate, particularly because they know that I'm very, very supportive of not only McShin, but all of the treatment programs we have here. I know we have some of the other people here from the Healing Place, we have Henrico Drug Court, we have Ms. Brown here from District 32 Reentry Program. And the reality is that all of these entities have to work together. And that is part of the recovery process, is having that support. And without these treatment providers...
I've learned a lot about recovery recently. I guess in the past 3 or 4 years, I've recognized that there's so many people out there that can offer so much, but it's not possible without folks like John, Carol, Shannon, that are truly committed to the success of those in long-term recovery and those who need to be. So I thank you. If anybody comes to Hanover, please stop in and say hello. We're a very welcoming community, but we also...
period of time, we were able to save over $8 million in taxpayers' money through programs such as the ones that John offered there at Richmond City Jail.
And I are faced with the pain and cost of addiction, but we also understand the joy of recovery, and we see that too, and that's really what gives us the fuel to go on.
Michael has a bunch of fancy titles. He's the Deputy Director of the White House Office of National Drug Control Policy. Hopefully he may be even moving up to a higher position as the drugs are, who knows. Before that job, he was the State Substance Abuse Director in Massachusetts for decades. And probably most importantly for this crowd, he is a man in long-term recovery. I'll let him tell you about that himself. And he's an incredible example of someone who is helping people, not only in his personal life, but has really allowed recovery to expand across people all in America. So let's give a warm Virginia welcome to Michael Botticelli.
It's really a pleasure and an honor for me to be here. I'm good. I have a loud voice, and I hope you can hear me. You know, as Carol talked about, recovery has really special meaning for me. About 25 years ago, I found myself handcuffed to a hospital bed as a result of my substance use. And so, fortunately now I've been in long-term recovery, and for me that means that I haven't found it necessary to have a drink or a drug in over 24 years. And so if you had asked me when I was handcuffed to the hospital bed if I would end up at the White House as the Deputy Director of the Office of National Drug Control Policy, I would have said that you were crazy. And you know, I always say that my story is not unusual, and maybe the White House part is a little bit unusual, but what's not unusual is the journey of recovery and what recovery means and the possibilities that exist when you are clean and sober a day at a time. And it's really amazing to me to be here. And really to be joined by some incredible colleagues. Melody, it's good to see you again. It is hard being a state director when you have huge need and lack of resources. It's really hard, John. It's really, really hard. So it's great to see you. And John and Carol, you know, one of the special things about this work, and I think you guys know it, are the people who do it on a daily basis and the people who advocate. I've known Carol for a while now and just had the privilege of meeting John today. But it really is what makes this field special and remarkable is the people who do this work on a daily basis. And we really owe them a tremendous amount of gratitude for not only today, but the work that they do in making recovery possible for so many of us. I know that I wouldn't be here if it wasn't for the work that they did. So, you know, today is really a day of gratitude. You know, every day being clean and sober is a day of gratitude, and we know how thankful we are and we need to be in terms of understanding and valuing our recovery. It's really too easy for those of us who are in recovery to slip back into old ways, but continuing to maintain the gratitude that we have is incredibly important. And, you know, I look around today and say, this is really what recovery is all about. It's really, and so it's really a pleasure to be able to join him. And I'd also like to acknowledge our Chief of Staff, Regina LaBelle, who's really remarkable and tireless in her work. She's really incredible in terms of the work that she does. Yeah, I've really been fortunate to be able to join this team. And as much as we have to celebrate, we still have a lot of work to do. Only 1 in 10 people who seek treatment for substance use disorders get it. And that's really terrible. And those of us in recovery, we're the fortunate ones. We are really the people who were able to find this. And our work is to really make sure that we have more people getting into recovery. As Melody talked about, the level of overdoses associated with prescription drugs and heroin has skyrocketed. You have 2 people a day in Virginia. We have over 100 people in the United States who are dying every single day of a drug overdose. And your efforts around Narcan, promoting Good Samaritan, are issues that we are championing at the federal level, and we will continue to do that to ensure that you have that access. And Representative, I really appreciate your efforts in terms of promoting that at the federal level. This is really a critical time for us in Washington and all of us here at the local. They have to make sure that insurance companies are not instituting discriminatory policies in accessing those benefits. So they have to make sure they're treating substance use disorders like any other health issue. And it's one of the most revolutionary things that has happened in healthcare reform and healthcare reform policy. But we also know that we need to make sure that our voices are heard. You know, one of the biggest things that we can do, and days like today represent that, is showing a face and showing a voice for those of us in recovery. I, as someone who holds a position, feel it my responsibility that I tell people about my recovery. It's really important I do that. And it's really important that you do that as well to the extent that you can. You know, as many people talked about today, addiction is a disease that affects every family. I've been doing this work for a long time, and I haven't met a family yet that it hasn't affected. Yet it's still the biggest secret that we have. And so by us being vocal and visible about our own recovery, about those of us who love us, our family members, talking openly and candidly, we can really begin to change that work. And we really have some work happening at the national level and at the local level to do that. Our office has been promoting recovery and has established recovery as a key area of focus by establishing an Office of Recovery. We're Recovery Month theme. Let's call on everyone, family members, friends, neighbors, co-workers, fellow churchgoers, local, state, and national leaders to join the voices of recovery. We will find pathways to wellness. We'll build healthier communities, healthier lives, a more prosperous nation for each and every one of us. So again, it really gives me great joy and pleasure to be here today with you as a person in recovery to celebrate recovery and really thank our champions who do tireless work for little reward to make things possible. So thanks for having me here today. So I'm glad I have people to remind me like things I have to do. So in celebration of Recovery Month, each year President Obama signs a proclamation, and I'll read that proclamation for you. And we have copies and framed copies here for John and for Carol and for Honesty. And I'll read it to you. It says, National Alcohol and Drug Addiction Recovery Month 2013 by the President of the United States of America. A proclamation. Each day, millions of Americans take courageous steps toward recovery from alcohol and drug addiction. Their examples reveal the transformative power of recovery, and their stories provide hope to those struggling to break free from addiction. During National Alcohol Drug Addiction Recovery Month, we celebrate their strength, challenge the stigmas that stand as barriers to recovery, and encourage those needing help to seek it. This year's theme, Together on Pathways to Wellness, encourages all Americans to walk alongside family, friends, and neighbors who are fighting to overcome addiction. My administration is proud to advance evidence-based approaches to recovery, approaches that view addiction as a preventable, treatable disease of the brain. The 2013 National Drug Control Strategy builds on our work over the past 4 years, increasing access to treatment and recovery services and supporting early intervention to address substance use disorders in schools, on college campuses, and in the workplace. And to give more Americans a chance to enter recovery, the Affordable Care Act expands mental health and substance use disorder benefits and federal parity protections to millions of Americans. Thanks to this law, insurance companies must cover treatment for substance use disorders as they would any other chronic disease. Alcohol and drug addiction remain a serious challenge in our country, but with the support from loved ones and allies, Americans seeking help making steady progress each day. As we observe National Alcohol and Drug Addiction Recovery Month, let us unite to prevent addiction, give hope to everyone still struggling for this disease, and to celebrate all those moving along the life-saving path to recovery. Therefore, I, Barack Obama, President of the United States, by the authority vested in me by the Constitution and laws of the United States, do proclaim September 2013 as National Alcohol and Drug Addiction Recovery Month. Thank you.
Reform to include reimbursement for recovery support services. So that's what we're looking for. Thank you very much for coming out, John and Patricia. Hang out. I'm going to walk you down to the barbecue stand in a minute. We got a lot of good music coming up, and we're going to probably...